Health Minister Dr. Frank Anthony spoke at the launch of the Human Papilloma Virus (HPV) scientific conference at Pegasus Corporate Suites on Tuesday and emphasized the importance of vaccination against it. There, he noted that cervical cancer is the second most prevalent cancer among women. Cervical cancer is a disease in which cells multiply uncontrollably and develops in the neck of the uterus or cervix.
And this is preventable by a vaccine, then we want to make sure that every child in this country is protected. The cost for such a vaccine and getting it through PAHO's strategic fund is minimal.
At the 2 days HPV scientific conference, healthcare operators and other stakeholders will be engaged on the seriousness of the cancer, preventing the ailment, and strategize to get more vaccination uptake in the country. As the health minister pushes vaccination use, Dr. Anthony said there will also be intense training on mitigating the spread of misinformation and myths about cervical cancer and the vaccines. One myth, he said, is that the vaccine causes infertility. Children from the ages 9 to 17 and adults from age 18 to 45 can receive the HPV vaccine. To get vaccinated, persons are encouraged to visit health posts across the country. Though the cancer is more prevalent in women, boys and men can also get cervical cancer.
In the first instance, we want to have a very clear focus on women. So basically a child from 9 to 15 and then from 16 to 45 to have persons covered. That does not mean that we are not going to work with boys, because the vaccine has also been proven to prevent certain types of cancer among boys, right? So we want to give them the vaccine as well. And so while our primary focus might be on cervical cancer, the vaccine is also beneficial for boys and men.
In Guyana, vaccination uptake in children is considerably high, with about 18 antigens or vaccines available. And the track record is between 98 to 100% overall uptake. Dr. Anthony, however, noted that the HPV vaccine uptake is low and the ministry is hoping to put more emphasis on the seriousness of this vaccine.
So either we are not putting a lot of emphasis on HPV vaccination, we don't understand the implications or how this is going to help people, and if we don't understand that, then maybe that's why we are lagging.
At this time, the vaccines are added to the list of pharmaceuticals under the ministry's healthcare program in schools. Reporting for the newsroom, Lazina Yearwood.